If a kid can't get blood flow to the tips of his fingers, tips of his toes, fingers are always cold, toes are always cold, they can't get blood flow to the tip of their brain. Tip of their brain is their frontal lobe. The frontal lobe is where all their cognitive skills are, their memory recall, their word recall, memory recall, their attentional networks, all those types of things are all in their frontal lobes. If we can't get blood flow there, we're going to have an issue. In this child's case, when we use a thermographic camera, what we actually see is the redder it is, the warmer it is. The more purple it is, the colder it is. So you can actually see blood flow in the tips of his finger. He starts losing blood flow and his fingers are purple on the thermography. And same with the tips of his toes, they're purple. That means he's not getting blood flow to the tips of his fingers or tips of his toes. That also means he's not getting blood flow to the tip of his brain. Because as those blood vessels get smaller and smaller and smaller at the tips of your fingers and tips of your toes, they do the same thing to the tip of your brain. So you're not actually going to get blood flow to the tip of your brain. And this is an underlying reason for a lot of difficulties in cognitive challenges. Main reasons for this can be anemia issues, not exercising enough, blood sugar dysregulation. So we put them on different supplementation to help with blood flow. We make sure we run some labs, make sure they're not anemic, and figure all the reasons out for why we have this blood flow issue. But first and foremost, check if your kid's having cognitive challenges. Check to see if their fingertips are cold or their tips of their toes are cold, and to see if when you squeeze their capillary bed, if it refills quickly, so it'll be white, and if it refills quickly to red, that's what we want. If it takes 8, 10, 15 seconds to refill, we know we have a blood flow issue.